All right, good evening everyone. Thank you so much for joining us here in person tonight. It's lovely to have you here in person, and it's fantastic to have everyone who's joining us online via the live stream as well. I'd like to officially welcome you to the Faculty of Health and Medical Sciences Medicine Admission Information Session. My name is Sasha Champion. I'm a student recruitment coordinator in the domestic recruitment team here at the University of Adelaide, and it is my pleasure to be your host and MC for this evening. So before we dive into things, I would like to do an acknowledgement of country, to acknowledge and pay our respects to the Kaurna people, the traditional custodians whose ancestral lands we gather on. We acknowledge the deep feelings of attachment and relationship of the Kaurna people to country, and we respect and value their past, present and ongoing connection to the land and cultural beliefs. So just a bit of quick housekeeping before we really dive into it. If you do need the bathroom at any point this evening, they are located just down through the front doors here and then out to the left. In terms of the format for tonight, the way that it's going to work is I will shortly invite our first speaker up to the microphone, Professor Martin Bruning, who we're very lucky to have join us tonight. Professor Bruning is a senior lecturer for the medicine program. And he's going to take you through a little bit about the medicine program, the structure, a couple of the key components. I'm going to then take you through the key admissions information that you need to be aware of, and then we'll jump into a Q&A session. So what we ask is, if you do have a question at any point this evening, we just ask that you keep those questions, you hold those questions until the Q&A session. And if you do have a question at that point, we just ask you simply pop up your hand. And we have a roving microphone that will make its way to you. If you are online via the live stream, we just ask that you pop your questions in the chat. Joining Professor Bruning and myself on the panel, we are also very lucky to be joined by two of our current medicine students who are currently both in their third year of the medicine program. So we have Imogen Ingham and Cooper McDonald, who will jump up on the panel and help answer your questions. So without further ado, I'd like to invite Professor Bruning up to the microphone to take us through the medicine program.
Great.
Thank you.
Okay, good evening everyone. Thanks for turning up and giving us your time so you can hear about the medical course. There's been a bit of a seismic shift in the medical course up to 2022. It was an undergraduate course, MBBS, and then in 2022 we started rolling out the BMD, which is the Bachelor of Medical Studies and the Doctor of Medicine. So, and what that basically means is that we've sort of upped the ante in terms of the AQF, which is the Australian Qualitative Framework. It's sort of basically, it's a rating of how many points your course attracts, and by increasing that rating, it gives our graduates lots of opportunity overseas as well as domestically. So yeah, a lot of work's gone into it. In 2022 we started off with year one. 2023 we've gone into year two, and now in 2024 we're in year three. So that'll gradually get taught through to sixth year, and the old course as it is sort of slowly disappearing. So, and it's a little bit confusing, but it's an undergraduate course. So the only way you can get into this essentially is through secondary school. There is a little bit of leeway through the health sciences pathway, but really you should consider sort of that the school way is probably the mainstay. And there's two separate degrees that you end up with at the end of the sixth year. So at the end of third year, I find students down here will end up with a Bachelor of Medical Studies, and then the only way to get to the next bit is by successfully completing the Bachelor of Medical Studies. So it's 2 degrees really for the one course, if you like. So, we're pretty proud of our health precinct down there on North Terrace with the new Royal Adelaide, Segenci, the Cancer Centre, SAMRI, the Research Development Centre and the Medical School, which has moved from Frome Road in 2017 to North Terrace. So it allows like a hub of all the experts and personnel that we need to deliver a really great course. It's very much focused on real-world scenarios, and perhaps the sort of the jewel in the crown over in the health precinct is our simulation lab, which is recognised worldwide, and many people from overseas come to see how it works. And the students, especially in the first 1, 2, 3 years, will be using the sim lab, as we call it. And then in fourth year, there's an all-out assault on the hospitals, if you like. Something that's changed with the new course is that we've brought in general practitioner exposure a lot earlier than we have in the past, and that's certainly proven to be very popular. And for the overall community medicine status, I think it's a really good thing. The other sort of things to note within the course is that so clinical placements are year 4, 5 and 6 basically, and that's sort of throughout all the hospitals, Queen Elizabeth, Modbury, Royal Adelaide, Lyell McEwin, and we also have a big footprint in some of the regional hospitals like Port Augusta, Whyalla, Port Lincoln. And there's an opportunity, if you're really so inclined, and it's a very great experience, is to spend a whole year in the country in year 5. So the whole curriculum gets delivered at either Lincoln or Port Augusta or Mount Gambier. So we have this wonderful opportunity for about 40, 45 of our students to do the entire 5th year in the country. And the other thing that's changed from the previous degree is that in year 6 there'll be a significant component there where there's significant research is undertaken. So that's one of the differences in the courses. So just a few faces. Danny Lew's our head of school. Ben Kenny's the director of medical education. Andrea's the program director for years 1, 2, 3. I'm the program director for the clinical placement years, and I'm one of the clinical deans down at the Queen Elizabeth. So we're sort of responsible for steering the ship, I guess. Other sort of world-class facilities we have are the anatomy labs, which are in the old medical school on Frome Road, and named after Ray Last, who was a former graduate and probably one of the world's leading authorities on anatomical dissection, and we're very proud of those laboratories as well. And there's the new sort of glass, beautiful building on North Terrace. Cost a bit of money. It houses more than just the medical school. It has dentistry, has the nursing school, and it's got the dental hospital right at the top, and of course the health simulation lab on a couple of floors. So it's got a lot of activity in there, and it's it's quite the hub of medical research and education. So we're very glad that we're there. And it's just a little word on our health simulation. So there are all these 36 simulation rooms all up, and we have dummies on which we can perform cardiopulmonary resuscitation. We have a lot of our exams there with surrogate patients, and we can tape all the exams and then play it back and examine how the students have gone. A lot of faculties actually use the simulation lab for their accreditation. So for the nurses, for instance, for anybody in the profession, it's very important that you keep up with your accreditation. And the SimLab provides all of these training experiences and is renowned as a leader in reaccreditation as well. So it really is a wonderful facility. So going into a little bit more detail, year one, we teach the foundations of medicine. So that's, sort of basic biology and chemistry and body systems. And then there's a focus on cardiovascular, respiratory and blood. And then we start just to introduce a bit of, medical practice workshops, once again using the SimLab. How would you talk to a patient? How should you talk to a patient? How not to talk to a patient? All these sorts of things. So it gets started really quite early, which is very different to sort of my day, when it didn't really get introduced till very much later on in the course. Year two, we continue on with system-based learning and focus on the neural system, endocrine, so hormones, digestive and urinary systems, and start to ramp up clinical skills. So how do you examine someone properly? What should you do? How do you go about it? And then year three, it starts to get a little bit more real, I guess, and all the students have a day out in general practice, which is really, as I said before, it's a major shift in the way of thinking at the medical school, and I think it's been a very good thing. There's a focus on child health and sort of fetal development, ageing and end of life, and there's also a gentle transition into the very scary world of the hospital environment in the second semester. So if you think of years 1 to 3 as getting all the ingredients in the cake mix, year 4, 5 and 6 is sort of when we bake the cake. Year 4, we commence full-time clinical placement. So that means the students become part of the surgical team. So for instance, I belong to the upper GI surgery team down at the Queen Elizabeth Hospital. So, tomorrow we've got our consultant ward round. We'll have 2 fourth-year students on there. We'll have a handful of sixth-year students. And, they're expected to be there at 7:30 and, help with the team and go to the operating room and help with admissions and really immerse themselves in a supervised environment, I hasten to add, in the whole experience. So fourth year, it's surgical medicine, orthopaedics, rheumatology, cancer and palliative care. Year 5, there's a bit of a focus on human reproduction and paediatrics, and also a little bit of anaesthetics and pain management, and some psychiatry and general practice. And then year 6 is really the transition into their internship. So there's a lot of clinical placements. They have the opportunity to travel overseas if they so wish, with an elective overseas, and or they could go interstate or stay in town, as it were. But it's very much a focus on, right, you're nearly an intern, we've got to make sure that you're safe and competent, which is what it's all about. So that's the medical course in a nutshell. There are a few exams along the way, and it is, it's a good thing. So just a little word there about the clinical placements. Overall, over the 6 years, there's 110 weeks of placement, so it's very much hands-on. There are some of our partners, which I've already mentioned, and the rural placements I've always mentioned. So, don't get the idea that we're just throwing students in and going, here, have a go. They are supervised by the members of the team. A little bit about bonded and unbonded. You may have heard that. If you opt for a bonded place, it means that eventually you'll be expected to sort of return that bond in the form of working in the country. That's basically what that is. Non-bonded places don't have that sort of, what's the word? You don't have to go to, no service obligation, that's the word. So, and career opportunities, well, the world's your oyster, really. I myself, I went into general surgery, but, I've obviously got an academic bent because I'm heavily involved with the medical school, and I, operate out at Sejourner and Port Augusta as well. So I'm here, there, everywhere. And, the one at the top there, general practitioner, is perhaps something that we've lost focus on, I must admit, and we're doing everything we can to encourage people, which is ultimately, it's the hardest profession, being a good general practitioner. I mean, it's one thing to know where to cut and how to stop the bleeding, but to be a good general practitioner, I think that's the real key. And at the end of the day, we want our medical students to be sort of undifferentiated when they finish the course. We want them to be safe, we want them to be competent, and we want them then to have the opportunity to do what they like, but we'd certainly like more to become general practitioners. You don't necessarily have to go into clinical work. There's plenty of opportunity in research, academia, public health. So it really is a career that can go many, many ways. Is that you now, becoming a doctor? Great, okay.
I can go through it? Yeah, absolutely.
Good. All right, well, thanks for your time, and no doubt there'll be some questions later on.
Thank you so much for that. Yes, I can jump in now. So what I'm going to do is take you through some more of the meaty admission stuff, go through the process, the requirements, a little bit about dates and timelines, just everything that you sort of need to know as an applicant. But I will start off with this. This is sort of your path to becoming a doctor from your first year in our program right through to your general registration, or your specialist training rather, with the further professional colleges. So this is sort of how we support you as a university. You obviously start off in the Bachelor of Medical Studies. That's the degree that you're aiming to get a place in. That's 3 years in length. Upon successfully completing that, you will get into the Doctor of Medicine, another 3 years. Once you've done those 6 years total in the program, you are eligible to apply for your provisional registration with the Medical Board of Australia. You will then go on, this is now, you've sort of left us at the university, you go on to do your year as an intern at an approved hospital. Once you've done that year, you are then eligible, as you can see, to apply for your general registration with the Medical Board of Australia, and it's at this point here that you can go on to apply for and complete your further specialist training. So those sort of specialist training is not offered by the University of Adelaide specifically. We do, obviously, as you can see, support you to get to that point, but it's not offered through the University of Adelaide. You'll go off and complete that through external organisations. Okay, so this is a nice summary table to summarise the key admissions information, key pieces of information that you need to know. So starting with our intake, as you can see, we intake once every year at the start of every year in February only. There is a certain academic score, a minimum academic score that we are looking for you to meet, and regardless of whether you are seen as a domestic student, a domestic applicant, or an international student, international applicant, the scores are the same. So if you are working towards an ATAR, or a selection rank in Year 12, we're looking for you to achieve a score of 90 or above to be eligible. If you are working towards your International Baccalaureate or your IB, you need to achieve a score of a 34 to be eligible. If you are considered an international student, you do have to meet a certain English language standard, and one of the ways that you can do that is through a test called the IELTS test. It's an international English language standard test, and if you do that, you'll need to achieve a score of 7. In that test. Duration, I've already talked a little bit about that. You've got 3 years in the Bachelor of Medical Studies, you've got 3 years in the Doctor of Medicine. Putting that total to get together, you've got a grand total of 6 years in the program. Prerequisites, we do have prerequisites. So prerequisites are subjects that we need you to complete in Year 12 in order for you to be eligible to gain a place in the program. So for our medicine program, we're looking at you need to have done one subject in Year 12 from either chemistry, biology, or maths methods. I'll talk a little bit more about this in a moment, but I just want to move on to this because this is a really nice timeline. I think it sort of summarises what your year in Year 12, if you're applying in Year 12 as a school leaver, what your year will sort of look like and what you need to be aware of at different points in the year. And this is looking at it from a perspective of a domestic student, a domestic applicant. So your prerequisite subjects, we put that first because that is something that you need to be aware of before you get to Year 12. You need to be sort of doing everything that you can to make sure that you are on the right track to make yourself eligible to complete one of those 3 subjects in Year 12. So, if you're looking at chemistry or biology, often you'll need to do chemistry. You need to pick chemistry, say, for example, in Year 10 and Year 11 in order to be eligible to do it in Year 12. So making sure you're making the right decisions before you get to Year 12 to make yourself eligible. Academic score is also number 2. We put that so early in the timeline because you won't necessarily receive your academic score until all the way at the end of the year, but we put it there because it does need to be at the forefront of your mind pretty much from day 1 of year 12. Again, you need to be doing everything that you can to put yourself in the best position to meet that minimum academic score. The UCAT comes next. So the UCAT is a formal part of our application process. You need to register for the UCAT and sit the UCAT in year 12. I'll talk a little bit more about specific dates in a moment, but there is a testing window every year. If you are in year 12, you will sit the UCAT at some point in that testing window. So we're sort of getting towards the middle of the year now, approaching sort of around this time really, May, June, July. The next step, once you've sat the UCAT, once you've got your UCAT score, is to actually apply to study with us. So this is you communicating to us that you would like to study our medicine program. And the way that you do that is you apply through SATAC, the South Australian Tertiary Admissions Centre. There is a date that SATAC applications open every year. Again, I'll mention that in a moment. And from that date, you can go in. When you're in 12, you list the medicine program in your preferences in your SATAC application. SATAC applications then shut. There is a date that you have to have applied to study medicine with us through SATAC. And once that date sort of passes, we then need to do some analysis to determine who will progress through to the next stage, which is the interviews. So you are advised if you are of your interview eligibility outcomes. So if you have received an interview, you are advised via email. The next step is for you to actually sit the interview, and this is right at the end of the year now. So we're looking, interviews are always held sort of from late November after your final year 12 exams, late November through to December, so right at the end of the year. Once we've done all of those interviews, we then, it's again right in December now, so we then have access to everything that we need to look at to determine who is made an offer. Okay, I'm going to break it down even further now and go into even more detail of all of those 8 steps. So again, number 1, prerequisites. 1 from either chemistry, biology, or maths methods. We're just looking for 1. You don't necessarily have to complete all 3 if you don't want to, just making sure you're doing everything that you can to make sure you are eligible to do 1 in year 12. Academic score, again, if you're working towards an ATAR, you need a 90 or above. IB, you need a score of 34 to be eligible. Please note, that's not a guaranteed score. Just to make yourself eligible, you need to be above that score. You'll also see that if you are working towards an ATAR, that score of 90 does include any adjustment factors that you are eligible for. So if you don't know what I'm talking about when I say adjustment factors, that's okay. Adjustment factors are additional points that you can be awarded in year 12 that will go towards your ATAR. And there are different types of adjustment factors that you can get. So there are 2 different categories. One category is called subject-based points or subject-based adjustment factors. If you study certain subjects in year 12, you can be awarded additional points based on those subjects. The other category is called equity-based points, equity adjustment factors. These are awarded to students based on your personal circumstances. So what I will stress here, even if you are eligible for subject-based adjustment factors, when you are applying to our medicine program, we don't consider subject-based points. So even if you are eligible, even if you have done certain subjects in year 12 that award you those points, we won't look at that. So you just have to make sure that your score is still high enough, is still above that 90 without considering those subject points to make you eligible. Okay, so the UCAT, again, so registering for the UCAT, it is something that you will have to sit in year 12. The only exception to that is if you identify as an Aboriginal or Torres Strait Islander student. There is the Aboriginal and Torres Strait Islander pathway where you do not have to sit the UCAT, otherwise it is something you will have to do in year 12. And again, there is a certain testing window. So if you are currently in year 12 looking to sit the UCAT this year, the testing window is, as you can see, from the 1st of July through to the 9th of August. If you're not in year 12, use these dates, use all of the dates that we talk about as a bit of a guide because they can tend to fluctuate here and there between the years. So use this as a guide. If you're currently in year 12, these are the dates you need to be aware of. The UCAT registration sort of closing date for this year is Friday the 17th of May, which is next Friday. So if you haven't registered, if you're currently in year 12 and you want to sit the UCAT this year and you haven't registered for it, go home and let that be the first thing that you do. If you want to avoid a pretty hefty late fee, got to make sure you've registered by that date. SATEC applications, this year SATEC applications open in August, so they open in August every year. The specific date will change year to year, but they open in August. And again, that's your opportunity to go to essentially tell us that you are interested in studying our medicine program. You want to be considered for our medicine program. If you're currently in year 12, you're probably going to be quite familiar with how the SATEC application process works, or you're becoming, working to be aware of how the SATEC application works. And similarly, if you're in year 9, 10 or 11 or whatever it is, you'll hear more about this as you progress towards year 12. But essentially you go in, you have spaces in your SATEC application, you have spaces for 6 different degrees. They're called preferences, 6 different preferences. Essentially your preferred degrees that you would like to study at university. You heard Martin talk about the bonded and the non-bonded program, students on a bonded place, students on a non-bonded place. You can see we've actually written out for you these 2 different places in the program have 2 different SATAC codes. So what that means is they will actually take up 2 of your 6 preferences in your SATAC application. So just make sure, if you want to be considered for all the places in the program, you are listing both SATAC codes in your application. Interviews, again, SATEC applications will close. We then need to assess who is eligible for an interview. And the way that we do that is we look at your UCAT score. So we will take approximately 600 students, top sort of 600 students of everyone who has applied to us, and we will progress them through to the interview stage. You will be advised, you always advise if you are successful, if you have received an interview via email, it's the same email address that you put on that you registered through SATAC with, whatever email address you put in your SATAC profile, that's the email that you will receive your notification. So this year, it's the 24th of October, that's when we will advise students if they've received an interview, so make sure you're checking your emails on that date. We do 1 round of interviews, and like I said, it's right at the end of the year, so from late November through to December. Really important to note as well, whether you're based in South Australia or you're based interstate or somewhere else in the world, our interviews for the next intake, for the 2025 intake, will be held online via video conferencing, so important to be aware of that as well. After the interviews, again, like I said, we're right at the end of the year now, we have access to everything that we need to see. We have seen you in the interview, we have seen your UCAT score, and now we have access to your academic results as well. And it's at this point that we assign a different weighting to each of those things to determine who receives an offer. So 20% is weighted to your UCAT score, 40% is your performance in the interview, and the other 40% is your academic score. And then sometime around, it's actually the following year, early January, this year's applicants, early January 2025, is when you will be notified if you have been given an offer. Okay, so specific dates. Again, these are really good dates to be aware of if you are currently in year 12. If not, use it as a bit of a guide. The next date, I think the most important date is, I've already mentioned, Friday the 17th of May, the UCAT registration closing date. If you want to avoid that late fee, like I said, go home tonight, get your registration done, then it's out of the way and you don't have to worry about it anymore. Monday the 1st of July, Friday the 9th of August, that's the UCAT testing window. Again, you'll be sitting it at some point in that window. Then as you can see, Monday the 5th of August this year is the SATAC application opening date. So from the 5th of August, you'll be able to log in, like I said, create your profile and list the medicine program in your preferences. Another really important date to be aware of is Monday the 30th of September. That is the SATAC closing date. So if you want to be considered for medicine, you must have applied to the medicine program through SATAC. So the medicine program has to be listed in your preferences before Monday the 30th of September. And the other really key thing is you have to have paid for your SATAC application before Monday the 30th of September. If you try to log in to SATAC on the 1st of October, 2nd of October, whatever, and try to add in the medicine program into your preferences, you simply won't be able to. That is a hard closure date. We do not accept applications after that date, so please be aware of that. Again, Thursday the 24th of October, is when we will then communicate to you whether you have received an interview. We've got that interview period from late November, and then offers will be made the following January. I know that was a lot of information in quite a short space of time. But I suppose what I just want to discuss here is the fact that there are alternate options. Medicine is a competitive program, and there are a limited number of places that we have available every year. So this is a good thing to consider if, there are lots of other ways that you can contribute to the healthcare sector, and there are lots of other degrees that we offer that will allow you to do that. So you might be interested in looking at, say we have a Bachelor of Health and Medical Sciences, we have a range of allied health programs, physiotherapy, occupational therapy, speech pathology. We have a great dentistry and oral health programs, and we have a fantastic nursing program as well. If you are in one of these degrees with us, if you are studying one of these programs here at the University of Adelaide or in another University of Adelaide program, there is what's called the higher education applicant pathway, which is where you can use your scores in these degrees, your GPA, your grade point average, your scores at university. You can use these scores as a pathway into the medicine program. However, please be aware that there are quite strict rules and there's quite a strict procedure around this, and the best way to read more about how this works is in our admissions guide. So all of the admissions information that I just talked about and all the information on that higher education applicant pathway, you've got information about other pathways, you've got key dates, you've got information about placements, you've got information about the interview. It's all in the admissions guide. So whether you want to scan that QR code, take note of that website, even if you just Google University of Adelaide Medicine Admissions Guide, it'll pop up. This is your one-stop shop to read about everything that you need to sort of be aware of. It's really a really good idea as well if you're not in year 12. Don't disregard this. Good to go through it and read it now at every sort of stage in your education journey right through to year 12. Just a good opportunity for you to check in and make sure that you're aware of everything that you need to know. If for whatever reason anything changes in the application process as well, this is the first place that it will be communicated. So a really, really good document for you to have on hand. Another cool thing I wanted to talk about is Open Day. Every year we have our Open Day. This year Open Day will be pretty cool because we will be opening up a lot of those facilities that you heard Martin talk about that our medicine students get to learn in and work in every day. We'll be opening them up on Open Day. So Open Day is Sunday the 11th of August, all day. The Adelaide Health and Medical Sciences building will be open. You'll get to see the simulation clinic. You'll get to be in the spaces that you might be learning in as a possible medicine student. You'll get to hear from other academics and teachers that might be teaching you in the program. You'll get to hear from current students, speak to current students about their experience. It's just a really good way. Open Day is a really good way for you to visualise what your life might be like as a University of Adelaide student. So highly recommend that you take note of this date. And if you do register now via the QR code up in the corner there, if you do register for Open Day now, you go in the running to win one of 3 $1,000 gift cards, which is a pretty good incentive if you ask me. So what I'm going to do now is invite our panel members up to the stage. As they are doing this, I'm just going to explain again how this Q&A is going to work. Thank you so much. Like I said, we're going to answer questions. We're all happy to answer questions about any sort of admissions questions that you have, questions about the program. If you want to hear a little bit about our students' experience in the program, the facilities, anything like that. If you have any questions that are a little bit more specific to you and your pathway, what we'd recommend that you do is actually get in touch with our Future Student Inquiries team, and you can do that via the contact details on the screen. So we're just going to keep it to sort of our general admissions, pathway sort of questions. So again, if you have a question, simply pop up your hand and we will find a microphone to make its way to you. Otherwise, I thought I might kick it off with a question of my own, if that's okay. I think both Martin and it would be interesting to hear sort of your perspective on this, Martin, and also your perspective on this. So I'm just interested in any advice that you can give to students that are looking to gain a place in the program. So whether that reflects on your own experience or any of the really common challenges that you see students face, any sort of advice to these potential medicine students that you can give.
I would say a lot of it is about planning, especially in year 12. It's like all those key dates and everything, it's really important. And you have to, I know for me, I started planning from about year 10. So, you know, you don't have to be, even if you're not 100% sure, it's better to be, you know, if you think it's an option, it's better to sort of be in the running earlier than figure out halfway through year 12. I know some of my friends figured that out halfway through year 12. Oh no, I want to do medicine, I want to do dentistry. And there's a whole lot more hoops you have to jump through if you're going to do it later rather than earlier.
It's a really good piece of advice.
I also think that if you are able to gain some experience, whether it's work experience, I know a lot of schools have requirements in year 10 or 11 to do work experience. If it's something that you're interested in, then getting in touch with whether it's medical practice or research as well, and having an opportunity to see what it's actually about, because there's a lot of things that we can say to you, but it's completely different when you're in the actual environment and working with a medical team and patients as well. So being able to have a look and see, is this something that you do actually see yourself doing, I think is important as well if you're able to.
Definitely. Do you have anything to add? It's okay if you don't.
Can I also just say something? Sorry. Just on that with experience and workplace stuff, I think that's really important. And also extracurricular activities. A lot of people study really, really hard, and then it comes down to the interview, and there's a whole lot of questions like probing you, like what kind of person are you? And it's really difficult to answer that question if you've spent a year studying in a room. So keep up with your hobbies, make sure you have experiences outside of school and outside of academics, you know, like something creative and fun and social, that builds your character as well for your interviews.
Just good for study life balance in general in year 12 as well. Sorry, anything to add?
No, look, it's all great comments there from the team. But look, you know, there's no doubt about it. Medicine, it's really hard to get into, you know, full stop. And it's a difficult course. You know, there's a lot of work and, you know, exams and hours and all the rest of it. So I think right off the bat, you have to make sure that this is what you really want, you know, that you personally want. And, you know, don't let it define you if you don't get in first time. I think you have to have a plan A, B and C. And, you know, if that means doing medicine, you know, I might get struck down by lightning here, but if it means, you know, having a plan going somewhere else, then if you want to be a doctor, then that's a good plan, and if you can get somewhere else. So don't put all your eggs in the one basket, have a plan up your sleeve, and you know, just as Cooper was saying, you have to be well-rounded. We want to have nice people who respect each other and you know, sort of look after each other, and you know, look after their own health and their own well-being and the well-being of their student cohort, and that means having slightly more interest than, you know, textbooks. So, you know, just be nice and study hard and have a plan A, B, C.
I think that's really good advice. I often, you know, when we get asked these questions a lot in terms of, you know, backup plans and things, I also, just to add to that, I also always say, you know, any backup options that you're looking at, any backup degrees that you're looking at, whether it's in the health sort of field or something else, you do want that choice to be something that you would be genuinely happy to graduate with, because like you said, medicine is competitive. There is no guarantee, doesn't matter how you're trying to get in, there's no guarantee that you are going to be able to transfer in. So think about those alternate pathways, think about those backup options, and like you said, just make sure it's the right option and decision for you. Any questions, thoughts? Okay, cool. We've got a question over on the end there. Oh, sorry, I didn't see that one. Yeah, cool, no worries.
Hi, okay, so what if we go for a degree like nursing, but then we want to get into medicine? So are the credits going to be enough to help us get into medicine? Or, like, obviously, because it's so much harder to get into medicine, so if we decide to do nursing or something else instead initially, but then we plan on changing our course, so does that work?
Yeah, I might have a go at answering this one if that's okay, and if you have anything to add. So what you're talking about is, for us, if you're studying nursing with us at the University of Adelaide, you're talking about that higher education applicant pathway. And like I said, it's a very specific pathway. But what you have to be aware of if you are in, whether it's nursing or health and medical sciences or allied health or law or whatever other degree that you are in, if you're trying to use that pathway, again, there's specific rules around it, and it doesn't matter how much study. You could have done 1 year as a nursing student or 2 years as a nursing student. You are always looking for a place in the first year of the Bachelor of Medical Studies. So it's not necessarily the same as typically what's referred to as an internal transfer. The higher education applicant pathway is not an internal transfer. It's a very different process. So again, it's available to you if you want to do that. Again, like you said, you just need to plan. You need to be aware of what you need to look at. If you are looking at that pathway, your application process will look very similar to students that are looking to gain an entry as a school leaver. So you still have to do the UCAT, you still have to do the interview. Like I said, the academic score is just slightly different. We look at your GPA, your grade point average, your scores at university instead of your score your ATAR or your IB score. So it's largely the same. Again, you just need to be aware of what it all sort of looks like for you, what it means, because again, you are always looking for a place in the first year. Doesn't matter what other study you've done, it's always the first year. But again, I recommend going to the admissions guide because there's a lot more information about the higher education applicant pathway. Amazing, cool. Sorry, over here.
So I got a question I would like to ask, but I just got a bit curious about this. So why would you choose studying medicine instead of like nursing or dentistry or something?
Yeah, that's a really
And
good
do you
question.
feel like regret or something, like regret about choose to study medicine? Yeah, this is my question.
Yeah, I think it'll be interesting as it currently in the program. Why did you choose it? And yeah, those thoughts around what sort of maybe helped reassure you that it was the right choice for you.
I think that for me personally, I had some previous experience in both with my job and like family connections as well. So I had experience in first just an interest in medicine. And then obviously there's, as we said, there's a lot of different health pathways and a lot of different jobs that are all extremely important within the kind of ecosystem of healthcare. For me personally, it was a balance between the being able to help people, as everyone says, and the science behind it, and the opportunity for research as well, which is what the MD course also has implemented quite strongly. But yeah, I think my interest started quite early on, and it was something that I knew I wanted to do, but it still is quite equally as important as a lot of the other health degrees as well.
I think you've planned this at a very convenient time of the year when we're very stressed out. So in terms of regret, maybe today would be a slightly different answer. But no, I actually don't regret anything at all. I think especially GP placement has really sort of confirmed, okay, this is like where I want to be. This is the part of it I want to like, this is like where I want to go with my career. So that's like that reassurance there. I think obviously in first year and second year, you're like, oh, you know, this is a lot of study. But now it's just, you're sort of reaping the benefits of that, and you can actually assist in helping people. Like, you know, I've given just small things like vaccines and just, you know, normal exams on, you know, listening to someone's heart. Like, you feel like you're actually part of, you know, oh, this is what I'm training to do. This is my career. So I think that sort of, as time goes on, it's more reassuring. Yeah, for sure.
Martin, I don't know if you can add anything from a staff and teaching perspective, how we sort of support students maybe with those moments and any like placement opportunities to give them, you know, opportunities to, again, reassure them that that this is right for them. I know that placement is a really big part of the program, but...
Yeah, look, I think the medical school does a pretty good job at supporting the students. I hope we do. And, you know, we have wellbeing officers, you know, for the years 1 to 3, and another wellbeing officers 4 to 6, because we know it's a stressful course and they see things that most of the community don't see, and they have to deal with things that most of the community don't have to deal with. So it can get testing at times from an emotional level. So both of our wellness officers are psychologists, and I think we're, you know, we've moved a long way away from, you know, 30 years ago where it was all pretty hard and, you know, sink or swim. Whereas I think we're a lot more holistic now, I think, and supportive of the students, and there are a lot of mechanisms in place to sort of support anybody that's in trouble, and that's probably a major change that's occurred. But there's no doubt that, you'll get sad seeing your first death, or seeing somebody unwell that you'd seen the day before that was well, and all of these sorts of things. So these are experiences that, you pick up on the way, but you've got no previous experience of, so it can be very difficult. And that's another thing you have to consider. It's not all, sugar and spice and like on the telly and all the rest of it. It does get hard and stinky, and people abuse you from time to time, and it can be very confronting, and especially when students go from years 1 to 3, where it's been a lot of lecture-based things, and then they go bang into the hospital system. It can sort of challenge some of the students, so we're very aware of that, and do our best to try and support everyone.
Definitely. Hope that helped answer your question. Any other questions? Just up the back.
Hi, I just had a question that for the interview from senior students, I heard that they ask about job shadowing and all that stuff. So I was just wondering if there's how do we get opportunities to job shadow as just high schoolers?
Again, I'm going to have just a go at answering this. But again, any insights, you're welcome to jump in. So in terms of the interview and the format of the interview, the best place to go if you want to read about how it works and information about, the format is the admissions guide. So I'd actually recommend that you go there first and have a read through, and again, see how it's structured and what information is there. I think you've sort of heard a little bit from these students that the interview is not necessarily an opportunity. We're not going to ask you to name all of the muscles in the leg. It's more about, you heard about understanding you as a person and why you may think that you're the right fit for this profession. So again, go there first, read through that, see if that answers your questions, and then if you have any other more specific questions, happy to chat more. Is that happy? Yeah, cool. Awesome.
I think you have to be very careful about what people tell you with these things, because there's a lot of urban mythology out there. You got to do this and you got to do that, and I think you always got to go back to the real source.
Definitely.
Job shadowing. That's anyway. It's all pretty straightforward, the interview, and it's nothing that's sort of out of left field, and if you're a good, well-rounded person, it's going to be fine.
Yeah, that's really good advice, definitely. Cool. Okay, just sort of towards the front here as Stephen runs to get there. Get his cardio in.
Thank you very much for the professor pointing out that the real life situation, that being a doctor is not all, the twinkle in the eyes, and everybody will, bow down to worship you because you've been through medical school and they're proud of that. But I think because of that, I think we just have to do some reality checks, not only, both physically and emotionally demanding to actually achieve the academic sort of standard required, but also as a mother, I think just wanted to see what type of quality, as a person, will go for the distance, because you're obviously there for other people. It's reassuring that the university has some supporting sort of network, so that the students will be given the opportunity to bounce back. But and they also provide some safety net. But what I'm sort of trying to get at is that we all get that it's hard work, but is there anything that as a person to be equipped to, to be the doctor they're called to be, like resilience, but how is there any sort of quantifiable qualities that you've seen through your experience that these are the likely people that if you have certain qualities as a person will last?
Yeah, it sounds like there's it's hard because there sounds like there's some skills there that we may not necessarily be able to teach. But I don't know in your experience whether you just from your experience.
It's very hard because you've got students coming in at 18 years of age, and then at the other end they're 23, and they've seen 6 years worth of stuff, and there's no doubt that things change during that time. I think some of the qualities you should have is just being nice, respectful, all those relatively simple human things, and it's also really important to have insight, and when you're in trouble to ask for help, because even as a consultant surgeon, we don't know everything, and sometimes we need to ask for help as well. So if the medical students get into trouble, we sort of certainly encourage them to let us know so we can help. But it's just basically about being a good human. I think that's the qualities you need. So it's not about being the best or the sparkliest or the strongest or the can lift the most weights or anything like that. I mean, it's just being a good human.
I think that's actually important advice, regardless of what degree you're studying in. That you need to, at university, you need to be able to recognise when you need help.
Yeah, I think I would just say as well, there's 120 odd people in my cohort or in third year, and we're all very different. So there's not one cookie cutter person is the perfect kind of doctor. Everyone's got their own traits and everything. People study differently. They know different things. But I think just for me, you just got to have the belief that you can get through it and keep pushing. Because if you stop believing in yourself, then no one else is going to do the study for you.
Really solid advice. Yeah.
I think the other thing to say too about medicine is, provided you're nice and you pass exams and all the rest of it, there's something for you out there. There's a niche. You don't all have to be specialists in the left shoulder or the right shoulder or whatever. There's something for you out there, and most people find that and enjoy being a doctor, I think.
Yeah, absolutely. We have still time for a couple more. One at the back.
Hello, thank you for your time here. Actually, just have a quick question regarding just back to one step, see about the, year 12s and the pre-required sites. You're talking about the mathematics, biology, and something like that. It's chemistry, and for example, for the mathematics, it has many different levels. Of the mathematics in the high school, and for the international students, when they go to the SOTAC, they say, we want to just, comparing our scores with the, the Australian scores. They don't have any, the exact, the level of the, for example, mathematics. The student should just achieve it before just as a, the acceptable pre-required sites here. For example, the general mathematics is acceptable, or they have to be just, a specialist mathematics in the, the scores.
Yeah.
Yeah, thank you.
I'm going to have a go again at this one. So what it sounds like, if you're looking at a specific qualification in a certain country, or the name of a specific subject that's offered at a certain school and the equivalent, again, this is where I'd actually recommend that you chat to our Future Student Inquiries team, because they have a lot more information. They can help you sort of discuss what exactly will meet the equivalent of the prerequisites that I sort of say. Again, that's very much from the perspective of a domestic applicant. So if you want to know the equivalency, I know it's frustrating, but I actually recommend that you contact them, because they can give you a lot more information, a lot more detailed information. Cool. Oh, sorry, we've got actually a question online, if that's okay. Yeah, sorry.
A lot of questions about UCAT and ATAR cutoffs.
Yeah.
I was just hoping you could explain how the cutoffs work and how we don't.
Yeah, for sure. So if you didn't hear, so that's a question about UCAT and ATAR cutoffs and how that sort of works. So again, I'm going to have a go at answering this, and then anything else you want to add, that's not a problem. So in terms of the UCAT score, like you saw in the slide when we're determining your interview eligibility, what we're looking at that point is just your UCAT score. And as you saw, we look at it's essentially the top approximately top 600 UCAT scores from all of the applicants for that year and progress them through to the interview. So when we're talking about UCAT cutoffs, it's not really possible for us to advise because we're not necessarily looking for a certain score. It depends on the performance of that year's applicants for that cohort. So the top, 600, approximately 600 scores for 1 year might be very different to a previous year's applicant. So again, it's difficult because the best advice we can give is you just want to do everything you possibly can to get your score as high as you possibly can to make yourself as competitive as you possibly can, but there isn't necessarily one clear-cut score that we can share. And similarly for the ATAR, there is a minimum score that gives you quite a range, minimum of a 90 or above. And that range exists there because, again, right at the end of that application period, we've got that weighting system. So we will look at your ATAR, your academic score, alongside your performance in the interview, alongside your UCAT again, and determine how you've performed in all of those things, alongside, factoring in the weighting to determine whether you get given a place. So again, what I can say about ATARs, you saw it on the slide, realistically, again, it's a competitive course. You'll hear everyone say this. You need to do everything that you can to try to get bump up your score as high as it possibly can be. But again, there isn't necessarily one score that I can say that will guarantee that you get an interview or that will guarantee that you get an offer. It depends on the performance of everyone. But one thing I can say as well, it can come back to prerequisites. Our prerequisites, again, we're only looking for one from chemistry, biology, or maths methods. So if you don't necessarily love chemistry and you're thinking, okay, maybe I don't look at doing that in year 12, picking the subjects that you know that you are strong at, making sure that you meet the prerequisites, yes, but picking the subjects you know that you are strong at is going to be another way that you can help ultimately get that academic score as high as it possibly can be. Hopefully that helps. Okay, cool. I think we have time for one more.
Thank you. Just a quick question in regards to the bonded versus the non-bonded program. What is the give back required on is it the bonded program that you then have to give back to rural placement?
Yeah. I might, if that's okay, if you want to. Is it okay if you have a go? I'm happy to, but just from your experience, because just from your experience, I'd be curious to know from your experience and what you've seen for the students that you've seen go on, and maybe you can talk to the other differences and the benefits of both.
I mean, the whole reason why they put this in was because nobody wants to go out in the country. I mean, that's the sad fact, and has it worked? It probably hasn't worked as well as they would have liked. But I think, is it 5 years? But I think some of that time can be sort of spent in training. And see, surgery, for instance, there's an attachment down in Mount Gambier, there's an attachment in Port Lincoln, so, that would count. And, before you know it, the time's up sort of thing. And, internships now we do at all the major regional hospitals, which is, light years ahead of what we did 20 years ago. So I think it's 5 years, don't quote me, but it's somewhere between 3 to 5 years. I know a lot of people sort of try and get out of it, and I don't know how successful they are with that, but it probably hasn't hit home as much as the government would have liked, to be honest.
Yeah. I've got something to add as well, but go for it.
I believe it's 3 years within an 18-year period of graduating from the medicine degree.
There you go.
So you still have to do your internship, which at the moment is 1 year, and then if you wish to specialise as well, whether you complete that either before or after doing your commitment to the country as well. But yeah, I think you do have an 18-year period to complete it. You don't have to do it all 3 years in one block. Like you could do 6 months blocks, I guess. But yeah, it's within that 18-year period, I believe.
Thank you. And just to go back to your point about, there is, you can say, a bit of a, not stigma, but, there's a bit of an association with the bonded program, what bonded places in the program. But I think, again, you can probably all really confirm this or deny this, but regional and rural experience, I think, is a really fantastic opportunity as a medical practitioner. The things that you get to see, the things that you get to do, going to be really valuable for you and the sort of span of your career. So I think, there's a lot of people don't like that idea, but again, there's certain rules around it. It's not like you have to do it straight away. It's not going to be forever. And it's going to give you a really fantastic experience.
Yeah, it's fair to say that the Adelaide lagged behind in rural exposure for a lot of years, and now it's pretty much integral in the students' curriculum, and by law they have to have, I think, 6 weeks of exposure at least at some stage during the time, and most opt to do more. So we do a 9-week surgical attachment in Port Augusta, for instance, in Year 4, and Port Lincoln and Whaler. So we've really come on board with all of this, and the experience is great. And 20 years ago, if you'd said to me that we'd have surgical junior staff or registrars out of Port Augusta, I'd say, you're joking. And but now we do, and it's part of the landscape. And in the eastern states, of course, they've been doing this for 1 million years, and because they've got the slightly bigger regional centres, but they've always, and we've sort of lagged behind. Flinders has probably been a bit more progressive in that way than we have, but so it is an integral part of the course now, and we certainly push the mantra that it's a good thing to do, and we thoroughly encourage it.
Definitely. I would like to say thank you so much to you all for giving up your Tuesday evening and answering your questions. I hope that you all enjoyed the Q&A session. I hope you enjoyed the session as a whole. But I will formally wrap us up there because we are out of time. So thank you to you all as well for joining us here in person. Thank you for joining us on the live stream. Again, any other questions that we didn't get to ask you, I'd encourage you to get in touch with our Future Student Inquiries team. Otherwise, I wish you all the best with the rest of your education journeys, regardless of what point you are at. I will also just flag that we do have another session, dentistry and oral health information session. Some of you might be staying for that, but we do have that starting pretty much straight away. So we'll have a bit of a transition as we get into that session. But again, thank you so much for joining us, and safe journey home to you all. Thank you so much.